All right, welcome back. And if you've just joined us, we're discussing the COVID-19 pandemic and actually looking at solutions and not just the issue of containment. And I have Dr. Joseph Minari, who is the Sub-Dean of the Faculty of Science at the University of Lagos. He's also a molecular biologist. I also have Dr. Tuime Bawodu, who is a public health physician. Let me start with you, Dr. Minari. Let's talk about the issue of survivors now. I mean, we're seeing people survive. In Nigeria, well, at least at the last count, we've recorded 2 deaths. In South Africa, in spite of the huge number they have there, I mean, the number of deaths, as at the last count, just 1. So why, but unfortunately, we are not seeing survivors come out to speak. Why don't you think it's important for them to come out to speak? Because that at least would give some people hope. Because the general impression most people have is that COVID-19 is like a death sentence.
Yes, thank you. Well, I don't think that is just peculiar to Africa. You know, even it took time for the agency in charge to convince people that you can't get HIV by shaking your hands. You know, anything like that, people will always want to be scared, even during the time of Ebola. Even those that recovered, by the time they came, you know, so many people ran away from them, at least at those early periods. And I think what can actually help to curb that is actually awareness. A lot of awareness needs to happen first, and then those people that have recovered should be able to come up to say that, oh, they actually had this and they've recovered, because that also will go a long way to be able to bring out people that have run away. You know, they are looking for some people now that they actually knew they had contact with somebody that tested positive, but because they are scared. So when you know that COVID-19 is not a death sentence, that you have people that can recover, that even majority can recover, so they can easily come forth. Okay. So they can come forth and be tested, and when they are tested, they know that it's not a death sentence, and the earlier you come forth, the better for you, so that you can be taken care of. But please let me make a particular point here too. Now, concerning also the death rates also, you see, it is very, very important that we don't take things for granted, because scientifically you must be able to explain everything that happens. We shouldn't just take it for granted that our death rate is low. It's subject to research, and not until we have a scientific explanation, it's not too good to just generalize, because the way, I'm emphasizing that the way the virus operates is very funny. It has a tendency to quickly mutate. So if it adapts to the situation in Africa and it changes and the rate of fatality increases, you know, there's a tendency that the death rate might increase. So, because if we play up that now, people will have the sentiment that, oh, maybe we are strong, and probably because of our genes, so we are resistant to it. So I will suggest we should not take it for granted. Rather, everything should be subjected to scientific analysis and proof, so that we'll be able to make a very strong statement, because the virus is funny. It could just get adapted here, and before you know it, the rate can just can escalate.
Dr. Mebaud, what have you got to say about that?
Again, it is so important that we should reiterate and repeat and loud our success stories, especially those people that were able to treat and discharge. They can actually be, you know, an incentive, you know, people with testimonials to the fact that COVID-19 is not a death sentence. But very key, what has happened in this situation is that we've allowed the foreign media to dominate the narration. What we see most of the time here is the number of deaths. Here is number of deaths in Italy, number of deaths in Spain, the number of infections in America, and that and that. Now, we've not allowed the domination of our own narrative that, okay, you know what, we have these 139 people with infection. We've only seen 2 deaths. Even those deaths were very old people, you know, and with other comorbid factors, and that we've seen all this success. That should be the domination. In fact, you know, initially when this thing started, I said that we shouldn't lose the sight that we must take hold of the information management. Now, if you make that a dominant discourse, if you make that, you know, to sink to the psyche of the people, and not the death sentence, and not the empty streets in New York, and Berlin and Paris, then the story can start changing.
But wouldn't that give some people a false sense of security? And let them just, you know, they now drop, instead of taking precautions now, they like drop their guards.
No, it's not. You see, you need to manage, you see, because again, the fear, you know, spreading fear may not even help properly. So the only thing that can help us is accurate information based on scientific knowledge. Understand? Because what the information we're not having is that in our own situation now, we're not seeing that level of fatality. Now that's an information.
That's true.
But while we maintain our prevention method, while we maintain everything we're doing, we ramp up research, we increase testing. Because now, if people see that, a lot of them will come out to partake in the testing. The rapid testing can then be scaled up, because if they know that, it's death sentence once you get it, and you are not disproving that, they will run away from testing. But if they know that it's not big deal, it's just like malaria, they will come out and do, more of them will do testing. It will allow you to do research. It will allow the narration to be different. So you must be able to come out with your own story of the whole situation. Pandemic it does not have a global uniformity, how it affects different community. But tell your own story. Tell your own story so that people can understand.
Okay, let me still stay with you, Dr. Mebaudu. I want you to give me your own take on the containment measures we are adopting here in Nigeria and across Africa, because it's just same thing. We don't have local adaptation, so to speak, with the exception of maybe one or two African countries. Everybody is going for a total lockdown. There might be problems with that. Could you just give me your own take on it?
Now, again, because now we are not having a full understanding of how this virus interacts in Africa. So right away, yes, there's nothing really wrong in that total lockdown. Because like I said, what that does to you is to slow down the transmission of the virus, the spread of the virus, and to reduce the burden on our, non-functional healthcare system, and they also give us the window to either do testing or do some research.
But don't you also think that if you're locking down, that there are certain things that should be in place? There's nothing wrong with locking down anyway, but...
Yes, I'm coming. So what should happen is this. If you're going to lock down, the assumption we're having now is that the only sickness in Nigeria now is coronavirus.
Absolutely.
But in far away local community in Lagos, there could be a woman who wants to deliver and is having complication. What provision have you made to take the woman to the hospital? In far away local community, maybe around Farasime or beyond that, there could be a baby convulsing at night and you have locked down. So again, the critical question is this: how are you making provision for other people, other issues, like somebody who is sick, other emergencies? There are no ambulance that can go around all those places. We don't have that. Then secondly, you know that the locking down will bring a lot of social tension. How are you distributing? Because you have local government councillors, you have local government chairmen. What are they doing in their local government street by street to really reach out? If it means that you have to take a truck to sell food at discount to people every other day, street by street, so that they can be restful. And then the other thing is that, the other thing that will make them comfortable, of course, we have challenge with NEPA. And then the areas of increased slums in Lagos, for instance, is a big problem. If you don't ensure that the flow of food, the flow of basic things goes into those slums regularly, you may stir social unrest. And like I said it some 2 weeks ago, and already we're seeing that. So in addition to lockdown, those things are very important that can assure people. And then, you have to really engage them, talk to them, so that they can be assured to stay at home and just wear out this period of the spread. But let's face it, don't let us think that a lockdown for 14 days will solve the problem. We don't know yet. We've seen Eritrea pushing for a whole 21 days lockdown. So beyond this thing, we should be able to learn
because
and see how to
that's
adapt.
the impression that is being created in some quarters that, look, after 14 days, then the problem is solved. When it's just you're only containing it.
14 days, which country, let's see, which country has done 14 days lockdown? Even that, none. We saw a whole month, in fact, some in Europe, a whole month. Eritrea, 21 days. You know, we're just using this as a first test to see, because normally during this lockdown, what we should be doing is increase our testing capacity and again, increase our information and discussion with people, see how to resolve some other social challenges that may come up, and then redefine, you know, how we're going to interact, you know, with people during the period. Now, and then, if we're not doing testing, if we're not increasing research, then what is the purpose of the lockdown? Because you can never tell. There could be a second wave of this viral infection. We must be able to think beyond a lockdown. You know, we like to throw we like to throw water at every fire we see. That is not the way it is done. You prevent.
Okay. Let me get your take, Dr. Minari, on this issue of lockdown that we see across Africa.
Yes, well, I think first and foremost, when you don't know what to do, at least you will just decide to do what others are doing.
Which is what we are doing anyway.
We don't really. That's what we are doing, because we are not prepared for anything. Even when our government was saying they were prepared, seems we are not prepared. So we just have, because we don't even know. We don't even have full information of how the virus is still being transmitted. You can see a lot of contradictory information flying everywhere. People saying, put on nose masks, don't put on nose mask, put on hand gloves, put on this, put on that. So, well, I would say staying at home for sure is the way to go for now. For now. And like you have said, that might not be the solution. That's not all. Because after 14 days, that does not mean that the solution will come. That doesn't mean the solution will come. So, it is just good for us to be able to do, number one, to try to slow down the rate of transmission. Number two, so that it will give the NCDC the opportunity to actively trace those that already have contacts. So that's very, very, very important for us for us to know. And then also very importantly, like we have said earlier, that if we look in addition to that, if we are looking at, okay, what can we bring out of this? Because I just pray that our government will learn from this. I know this pandemic will actually come and it will go. But I want us to learn a big lesson from this. Because if the same thing that is happening elsewhere, if the death rate has been in Africa, it will have been so bad. Because, yes, because just imagine that it's in Africa that we're having the statistics we are having in the United States, and then we are waiting for them to bring solution. I think it's a lesson for us. You know, I even realized that in terms of research, because we feel that, oh, easily we can move, they can actually travel out of the country for treatment. You think that our doctors are not good, our medical doctors are not good enough. But now, you have to stay put. Oh, our educational system is not good enough. We are not doing it. No, you have to stay put. There's nowhere to go. And that's a big lesson for. Do you know that even in Nigeria, we most of the time even have the tendency to struggle and get grants outside of the country to our institution, even that we get here. There was sometimes ago we got a grant from United States, from Seeding Lab, over 70 million, you know, through the leadership of our Vice Chancellor, Professor Gudipe, and our Dean, Professor Adekule. You know, we got into the faculty, into the Department of Cell Biology and Genetics. But where can you get that in Nigeria? We can't get such here. You know, we don't believe in ourselves. We don't believe in our medical doctors. We don't believe in our institutions. All our children are just traveling out. And so we just discussing about petty things here, instead of us to invest massively into the educational, because this has actually exposed our weak links now. Completely. We already know that we have a big lacuna in our health sector, a big lacuna in our educational sector, and it's showing even in our organizational structure, because for us to even distribute the food now is a problem. There is no structure on ground to get people. So to even distribute now, the government is racking on how to bring people. How do you have the data to even know these are the poorest in this community? How are we not sure that it's not the same people that are taking it? So those are the things that I think the government should learn. It's really a privilege for us to learn and put our house in order. God forbid that in the nearest future, things that is more terrible like this is possible to happen and might take root in Africa. Are we going to say we are going to wait for them there in the West for them to react or to react first before we too begin to react or to respond? We need to be proactive. And I just hope that with this, we are able to put our house in order properly and then put the proper infrastructure in place so that we can develop our educational system well, our health sector should be well developed so that in future we'll be able to combat this. They can copy from, who says, like you rightly noted earlier, who said they can't get solution from Africa? Who said we can't get the treatment first in Africa? Who said we can't get the vaccine first in Africa? Who said so? We have people from Nigeria going out of the country doing well, are people that finish from our universities here. They go there and perform well. So who says we can't do well here too in Africa? So I think it's high time we began to look at how we develop our educational sector here in Africa and Nigeria, to be precise.
Well, I can just imagine if, for instance, imagine the billions of naira that the wealthy people in this country have been contributing in support of the fight against COVID-19. Yes. Imagine if we had a situation where these wealthy individuals had before now come out to contribute this huge amount of money now for research and development. Perhaps we would not be where we are now. Dr. Tuyime Baondo, yes. let me just have your last take on this.
Well, for us, let's not deceive ourselves. This COVID-19 will come, run its course, and then we'll start counting our loss. But I just hope that this will be a turning point in our lives in a lot of areas. I just hope that we can learn the lessons. I just hope that going forward, we'll be able to sit down and look at how to build a health system, how to strengthen the scientific community, how to actually, ensure, budget prioritization to ensure that, human capital development becomes a priority, in our society. But while we're working at this, the main issue now is for everybody to embrace those hygiene, sanitation, hand washing, social distancing, while we encourage and hope that our medical professional and scientific community will develop a treatment, a treatment that we can use before a vaccine or any other treatment comes. And let's get it that this will not be the end of an epidemic or pandemic. We have Lassa fever ongoing.
Yeah,
another one will
killing more people
us.
in Nigeria, actually.
That is the challenge. We've not seen the end of epidemics. Not in Nigeria, not in the world. But let's be prepared.
All right, gentlemen, thank you very much for coming on the program and for your contributions. Dr. Joseph Minari, who is the Sub-Dean of the Faculty of Science, University of Lagos, and also a molecular biologist. Thank you very much for your time. Dr. Tuyime Baondo, thank you very much for coming on the program as always. Thank you very much, gentlemen.
Thank you, sir.
All right, that's it on the program, but if you want to watch it again, it's very simple. Just go to our website, tv360nigeria.com. You'll find this program and lots more there. You can also follow the conversation on our various social media platforms.
Thank you, sir.
Thank you very much for watching. I'm DEJI360. I'll see you next week.